So this is me. I'm the International Programme Director for Link Education International, formerly Link Community Development International. So the descriptor for this session, we know that COVID-19 is hitting the most marginalised the hardest. What actions are needed to ensure that equity and justice are at the heart of the COVID-19 recovery and building resilience amongst those most marginalised? So I found a few quotes, both from the UN and both from July, but what they show is that COVID is truly global, but it's not equal. It's affecting different people and impacting the marginalised and the most vulnerable the hardest. So just to think about the marginalisation landscape, we know that marginalised and the vulnerable are a broad section of society. They're not a homogenous group, but rather encompasses many different people experiencing different barriers and challenges. And if we better understand those challenges, we can better support everyone through this pandemic. And then a few stats from the World Bank, from the UN, from the World Health Organization. References are at the end of the slide deck. And these just show the impact on these marginalized groups. And unfortunately, the negative coping mechanisms that seem to have developed to help people cope with COVID, such as child labor, such as GBV, such as child marriage and neglect. I'm not sure where that's appeared. So we now want to go into our 3 discussion groups, one on disability, one on gender, and one on LGBTI+. While the tech organizers are putting us all into those groups, I thought I'd just give you a short introduction to the different speakers and facilitators we've got today. In the gender group, I'll be facilitating that, but we have Abaynew Mulat, who is the Safeguarding Gender and Inclusion Coordinator from Link Education in Ethiopia. He has a lot of experience in girls' education, in safeguarding and child protection, in gender-based violence prevention, social inclusion, and emergency response. So he'll be presenting to us in the gender room. In the disability breakout room, we have Elfreda Whitty, who's the program manager for CBM UK, and she'll be facilitating that room. She manages projects in Zimbabwe, Malawi, and Zambia, which aim to empower and improve the quality of life of people with disabilities, ranging from girls' education, community mental health support, and livelihoods. And the speaker in that room is Emile Cadet Vuningabo, who's the project officer for the National Union of Disability Organisations in Rwanda, and he manages a Scottish government-funded livelihood project for people with disabilities. And in the third room, we have Scott Cutherbertson, who's the development manager for the Equality Network, and he leads the organisation's work on community development and their international work. And the speaker in that room is Juan, Miguel, Sánchez, Marin, and he is the programme manager for the Kaleidoscope Trust, which is the UK's leading LGBT+ international charity. And he's a law-based human rights and development practitioner. So some great speakers for us today. These are the breakout group questions. So these are the 3 questions that we didn't really get to in the gender session, but there was beginning to be a good discussion. So I wonder, could we start with the disability breakout room? And Elfreda, could you maybe some feedback, some discussion points?
So yeah, so Emile gave a presentation about the situation in Rwanda, and really highlighting how people with disabilities are facing more marginalisation than other groups. And one thing that really came out was the importance of working with disabled people's organisations that represent people with disabilities, and ensuring that they're part of the, of the conversation, that they're part of the planning when we're looking at recovery. And I think that's a key point, is ensuring that people with disabilities are represented, and when we're looking at building back better and planning and reshaping how things are. And a really important element of that is advocating to our governments to ensure there's that awareness, both in policy making but also implementation, and that the general population is also aware of the additional vulnerabilities that people with disabilities face in terms of COVID-19. And hopefully this very difficult situation will be a catalyst for more inclusion and building back better, including people with disabilities in that.
That's really interesting. I think probably one of the key takeaways. Thank you, Elfreda. Could we go to Scott?
Yeah, I'll try and keep this as brief as possible. I might need Juan to interject if I go off track. So we talked briefly about who has been most impacted, and given that the LGBTI community is not just one community, it's actually subsets of lots of different communities coming together. We talked a wee bit about some of the different impacts across so LGBTI plus people living with HIV, trans people, intersex people, and how different impacts are made by those. So for example, we know already that there's an issue around how LGBTI people access healthcare, because sometimes they're scared to go to providers and it might reveal things about themselves that they don't want to be known. And so COVID is exacerbated that impact. There was some great examples by Juan about how when we look at specifically at why LGBT communities have been impacted, a lot of it is around pre-existing discrimination that is going on. There was the example of the LGBT shelter that was raided in Kampala. So existing structural discrimination and COVID being used as an excuse. I mean, it happens here a lot, but whenever there's a disaster or a hurricane in the States, or and COVID has now come along, it's often that some people will come forward and blame it on LGBT people because LGBT people are not fitting in with the norms of their society, that it's LGBTI people that are to blame, and that quite often is around some of the whys and the structural things around that. In an ideal world, how do we address these? So we had a brief discussion about data collection and how important that was. There are a lot of organisations in the LGBTI sector collecting that data, of which I'd encourage you to have a read at the Kaleidoscope Trust report. I'm sure you'll find it just by Googling their website. That was across 37 countries and it was really important. There was also a brief discussion about how funders deal with LGBTI issues and the mix between some funders who have been really flexible and some funders who haven't been. So mainly we found, one report found that governments have been very inflexible with their funding. We already know that LGBTI is a very underfunded stream by government. And there's only one or two countries, and I have to say Scotland is one of those countries where LGBTI funding has been made to become very flexible to cover this pandemic. And also from philanthropy, a very mixed response about how they adapt to LGBTI communities who already had low levels of employment, were already struggling to to feed their families and to feed themselves. So it's just about how COVID has exacerbated those. And I don't know if, Juan, did I miss anything out in that very brief?
Nothing. Very beautifully done. So yeah, it's about the importance of data and including LGBT plus people responses to make sure that they are included in whatever measures governments or agencies or whoever decide to take of LGBTs, just bringing them to the table and listen to their needs. That's what's needed.
Mm-hmm.
Thank you, Scott.
Great, thank you. I've been taking notes. I think I've got some nice key actions for us. But just to sum up the gender room, I know we've got about 8 minutes left. I think that's right, Philippa. So in the gender room, we had the presentation from Abaynew, who described our project in Ethiopia, and he mentioned that the gender room, the girls for our girls project who are most affected are the orphans, the girls with disabilities, and the young or new mothers. So there's this intersection between the girls who are marginalised. And our project has come up with lots of different ways of how to address these issues. Oh, sorry, first the why. Why are these girls most marginalised? It's generally to do with the gender, the social norms within the context that we're working in. Girls are given more chores, boys are prioritised for education, and Abaynew talked about the increase in sexual violence because the communities, people are coming back to be in the communities, and there's an increase in tension and the need for livelihood. So going back to those negative coping mechanisms that I described at the beginning of the session, and the project's doing several things to address these challenges, is looking at social and emotional learning when the girls go back to school, TV and radio messaging to raise awareness of these issues within the community, and also raise issues around how to be safe with COVID, safeguarding messaging, that everyone needs to go to school and the value of education. And also just in brief about the coordination, so the project's not working in a silo, it's working with other actors in the area that we're working in and sharing our data that we have. So it's interesting that, Scott, you mentioned data. We did a rapid needs assessment to find out how COVID was impacting our project girls, and use that data to adapt our activity accordingly. So that's very interesting, and Abaynew talked about it being a holistic project. So trying to address all of the different challenges that our marginalised girls are facing. I'd really like to hear from other people. Nicola, Natalie, you had a question about keeping in touch with girls, or I think any marginalised group during COVID, and the challenges around being able to do that digitally. Often we're working in very remote areas where there isn't any digital connection. So I wonder if anyone has any suggestions for Natalie on that. How to keep in touch with these marginalised groups in these remote areas.
I could say something, Sam, and maybe Abaynew can also add. Hi, I'm Sandra. I work with Abaynew in Ethiopia, and I'm from Link Education International. One of the ways that the project team in Ethiopia found to keep in contact with the girls when schools closed in March was to collect the phone numbers of all the village leaders, the village elders and the village leaders, and work through the village elders to keep in contact with the girls. So the village elders would provide information about the girls in that particular school community, because Akabeli is kind of the lowest level of administration, if you like. So they would keep in touch with the girls and their families, provide information about how they were doing, so that the project could also continue to consider what kinds of additional support might be needed. So that was one way to keep in touch with the girls. Some of the assistant project officers in the project also used phone where it was possible, but not all of the girls, of course, have access to phone or to radio or to any other kind of technology, but they did manage to use that as a method of keeping in touch as well. Thanks.
Great, thank you, Sandra. Really keeping an eye on time. We've got 4 minutes left. I've just had a quick flick through and I haven't seen anybody with their hand raised. I haven't checked the chat box. Is there anybody with a question in the chat box? I don't think so. I think Philippa's, you shaking your head?
Yeah, there was a point from Elfreda, which I think you picked up on the disaggregation of data and how critical that is to really understanding essentially what the issues are, but there aren't any other questions which are coming in.
Okay, great, thank you. I did want to make a point that Fiona in our group did mention that where she's working, I'm sorry I missed that, Fiona, that it's not just women who are affected, but it's men and boys as well. So gender doesn't just mean girls and women. I think we're all aware of that anyway. So I think we've got 3 minutes. So the key actions that I've taken away, please jump in if you disagree or would like to add more. So Elfreda and Scott, I think all of us talked about the importance of people who are affected being part of the recovery planning. They need to be part of the discussion, they need to be part of the policy making, and they should be part of the advocacy around with governments. But maybe their inclusion will be the catalyst for building back better. I think that's a great point from Elfreda. Scott talked about the importance of data collection, absolutely right. And again, disaggregating that data, as Elfreda said. And Scott also talked about the need for funders to be flexible with how their money is spent. We're all having to adapt programming to support the most marginalised. We know the most marginalised are being affected in different ways. So we need some flexibility about how the money is being spent. So those are the 3 takeaways that I've got. Does anybody want to add anything further to those?
There's a point from Emile in the chat box. So
can you read what that's?
Yeah. So Emile's saying that in Rwanda, they've started working with UNDP to look at research on the impact of COVID-19 on socioeconomic status for people with disabilities. I think Julia's keen to know if it's possible to share that.
Yeah, thank you. It's still under, it's still ongoing. So of course we share the final report from that.
Great, thank you. And we will we'll add the key actions to these slides when we share them with everybody as well. So everyone will have those. Is there anything else anybody would like to add? Perhaps we should just see if there's any more hands raised. Anything else in the chat box?
Nothing else in the chat box.
Okay, I don't see any hands raised.
I think we're in perfect time.
Really thought it.
Amazingly.
Great. So what happens now? Do we get?
I think we can wrap up. Are you happy to wrap up, Sam, or would you like me to?
Yes, thank you very much, everybody, for being part of this session. I hope you found it useful. It was very quick, but I think we've come up with some really excellent takeaways that we should all try and push forward and share with our wider networks and funders. So thank you, everybody, for attending.
Thank you. It's been wonderful that the tech has behaved well and we've been able to have contributions from so far and wide. Thank you very much. Thank you, Sam, for chairing the session and the group, and hope to see folks throughout the day at the exhibition stalls. Thanks to our headline sponsors. Please join the live chats if you can, and please reach out to us if you've got questions or any challenges. It's been a really inspiring and thought-provoking session, and let's keep those conversations right at the top of the agenda.
Great, thank you, Philippa. Thanks, everybody.
Thank you.
Thank you.